Whenever we talk of any infection, it is always important to note and to be aware of what are the differences in the presentation of that infection, or what are the likely complications of that infection when it comes to few high risk and very delicate groups like pregnant women, newborn kids, pediatric age group patients, and adults who are above the age of 65 or who have various medical problems. So, hello friends, I am Dr. Piyush Chaudhari, bringing to you the next video on the YouTube channel of Fever Care Center for Infectious Diseases, in which we are going to discuss what are the differences in clinical presentations and complications of chikungunya infection in various high-risk groups that we have touched upon briefly in some of our previous videos related to the symptoms and diagnosis of chikungunya. So starting with high risk groups, we'll first start with pregnant women. So unlike similarly spreading other infection like say Zika virus infection, in chikungunya, the infection is not so problematic during the first and the second trimester of pregnancy. In fact, if a pregnant lady happens to get chikungunya infection during first 3 or 6 months of pregnancy, there are almost no adverse impacts on the fetus that is growing in her. But if the infection occurs closer to the time of delivery, especially around 1 or 2 days prior and 4 to 5 days later during the mother's symptoms, if the delivery happens to take place, then during the labor phase there is a almost 40 to 50% chance of this virus spreading to the newborn neonate. Now, in such situation, almost every newborn who contracts the infection from the mother develops some or the other symptoms. Common symptoms like fever and rash obviously remain there, but good part is the pain or joint related symptoms are much milder compared to adults. Bad part being, in these newborn children, complications related to secondary bacterial infection or systemic complications related mainly to infection of the brain leading to meningitis, encephalitis, or infection of the skin, or even bacterial sepsis, meaning spread of bacterial infection in the body because of weaker immunity, are far more likely in these newborn children. When we come to a little higher age, in the pediatric age group from several months to few years, again symptoms are more or less similar like adults. Differences being they are more likely to have loose motions or diarrhea. The rash in newborn as well as pediatric age group is multi form compared to adults. So not just maculopapular rash, but they can get different other types of rashes like bullous rashes, vesicular rashes, etc. And systemic complications like meningitis, encephalitis are far more common even in pediatric age group compared to adults. That apart, in pregnant ladies, newborns, or pediatric age group, there are no other major differences when it comes to chikungunya infection. And important thing being, mortality related to chikungunya, even these groups is relatively less, whereas morbidity does remain significantly high. Now coming to adults with medical comorbidities, the main high risk factors are diabetes, hypertension, heart disease with coronary artery disease or heart failure, patients who have COPD or hypothyroidism, and patients who coincidentally seem to have co-infections with other infections like dengue, HIV, tuberculosis, etc., along with chikungunya. So in these patients, the most important feature is that their severity of joint pains and the duration of joint pain can be much longer. Additionally, there are some impacts on their underlying comorbid condition also. Like for example, in patients with diabetes, the glycemic control, so control of their blood sugars, which may be proper before getting chikungunya, can get highly disturbed during and post chikungunya infection, and their sugars can go very high, requiring increase in dose of their diabetes medications. This becomes even more important when in some of these patients steroids have to be used for managing the chronic or subacute joint pains. So we have to be very careful in this particular set of patients while using steroids during treatment. When it comes to high blood pressure, the patients who get chikungunya during the acute phase tend to have much lower blood pressures than their usual normal baseline ranges. So their antihypertensive medicines may have to be reduced in dose depending upon their blood pressure readings. One particular thing, if we do not pay attention to this, they may get complications because of drop in blood pressure, or they may get falls because of hypotension and dizziness. Additionally, in most of these high risk groups, there are more chances of systemic complications like involvement of brain leading to meningitis, encephalitis, or involvement of lungs leading to breathing difficulties, or acute involvement of kidneys and liver leading to derangements in kidney or liver functions. But all these complications are much lesser when it comes to chikungunya compared to dengue. So overall, it is always said that directly attributable death risk or mortality related to chikungunya is very low, although morbidity can be extremely high. So what are the different treatment modalities to reduce this morbidity and to alleviate the pain related symptoms of the patient? That is what we are going to discuss in our next video on the YouTube channel of Fever Care Center for Infectious Diseases. If you found this video useful, please like, share and subscribe our YouTube channel. Remember, stay informed, stay healthy.